Pus or blood clot. So, which of this is blood clot? This or this? Not the regular septations here, the irregular septations here, not what looks like peritoneal thickening here, which is not seen here. Video of the first case, 29-year-old at 13 weeks, lambda sign, twin pregnancy with spontaneous ovarian hyperstimulation syndrome. So, what is this? Blood clot or pus? From the history, this is more in keeping with hemorrhage into these cysts, which on follow-up has shown some diminution in size. On the other hand, this 20-year-old presenting with 9 months history of fever, cough, abdominal pain, and swelling on the bladder, the uterus, the bowel, the peritoneal thickening that has separated this lesion from the pelvic organs. And here, not this. Is this pus or blood clot? Not the irregular septation, the palisading of bowel, the omentum encasing this lesion. Again, not the irregular septations compared to what you see here. Not this regular and thin septations here. So look at this. So this turned out to be pus, not blood clot. How do you confirm that? Because in this case, we are suspecting peritoneal tuberculosis. So we decided to get tapped for cytology and AFB. As you can see, the needle going in here. So the content here actually was straw clot. But when I went further down into these cysts, and the content turned purulent. So this is pus, not blood clot. So going back to our first slides, which of this is blood clot? Now, if you look at this image of a 20-year-old who presented with a 9-month history of cough, fever, abdominal pain, and swelling. This is a coalition within the peritoneal cavity and is not ovarian in origin. Not this peritoneal thickening, which others describe as a blanket. Not this irregular and thick septations. This, of course, was confirmed to be pus. On the other hand, not this case of a 29-year-old with twin pregnancy at 13 weeks who had ovarian hyperstimulation syndrome. The ascites was so massive and tapping was necessary to reduce the respiratory embarrassment. On follow-up, the size of this clot had diminished. So this is blood clot, while this is pus. But from the literature, pus is described with this lacy content. You can see the lacy content here, but the lacy content is not so obvious here. So it could be difficult to actually differentiate pus from blood clot. But history is the key. So our learning point is that on ultrasound, history is key in differentiating between blood clot and pus. Thank you very much.